Hello, welcome to this special session of the Sony Technology Exchange Fair called STEF Conference 2022. The title of today's session is AI for Social Impact, Results from Deployments for Public Health. It is my pleasure to welcome Professor Milind Tambe, who is the Gordon McKay Professor of Computer Science and also the Director of the Center for Research on Computation and Society at Harvard University, as well as the Principal Scientist and Director for AI for Social Good at Google Research. So welcome, Professor Tambe. It is a pleasure to have you here. And I would also like to introduce you to Dr. Hiroaki Kitano, who is Sony Senior Executive Vice President and Chief Technology Officer of Sony Group Corporation. And my name is Alan Sumiyama. I am the head of corporate technology strategy at Sony Group Corporation. And I'm honored to be the moderator of this session. So thank you, Milind. Thank you, Hiroaki, for joining. So without further ado, I would like to ask Milind to begin his talk on AI for social impact, results for deployments for public health. And that this will be followed by dialogue session between Milind and Hiroaki. Please go ahead, Milind.
Hello, my name is Milind Tambe. I'm from Harvard University and Google Research, and I'm going to talk to you today about AI for social impact. So for the past 15 years, my team and I have been advancing AI and multi-agent systems research for social impact, focusing on topics of public health, conservation, and public safety and security, with the key challenge of how to optimize our limited intervention resources. I'll start by giving some background about our research. The first point is that achieving social impact and AI innovation go hand in hand. And I want to convince you that AI for social impact doesn't mean just taking AI out of the box as is and applying it towards social impact. Innovation is required, and we see this, for example, in the area of public health. Here we have large populations to serve limited number of public health resources. Concrete example is work we've done with youth experiencing homelessness in Los Angeles. We're harnessing the social networks of these youth. We are able to show that our social network influence maximization algorithms are far more effective in reducing HIV risk behaviors compared to traditional approaches. But this work required innovation in the area of social network influence maximization because the networks themselves are not known ahead of time. With respect to conservation, we have large conservation areas to protect, but limited number of ranger resources. Concrete example is work we've done in Uganda and Cambodia, where harnessing past poaching data, we're able to predict where poachers or traps or snares, and for the past several years, have been able to remove thousands, if not tens of thousands of these snares. But this work required innovation in the area of what we call green security games, which combines machine learning and game theory. With respect to public safety and security, we have contributed a new model called Stackelberg Security Games and contributed new algorithms that have been in use by security agencies in the United States, such as the US Coast Guard, the US Federal Air Marshal Service, and others. These may seem like very different application areas, but what ties them together is the underlying common multi-agent systems research. Today's talk, I'm going to talk about AI for maternal and child care. I'll cover papers from the last 2 years on this topic. I'll focus on real world results in this talk, but there are more simulation results in our papers. And I'll highlight the role of the lead PhD student or postdoc by putting up their picture in the top right-hand corner of the slide on which their work is shown. So the motivation for this work is the UN Sustainable Development Target that by 2030, the maternal mortality ratio should be below 70 per 100,000 live births. That is, mothers dying during childbirth or soon after should be below 70. That's the UN target. If you look at where we are today, Western Europe, much lower numbers, United States rising, but still much lower. In the developing world, the rates are falling for maternal mortality rate, but they're still higher, for example, in India, higher than 100. And that's where we begin today. This high maternal mortality ratio implies that a woman dies in childbirth in every 20 minutes in India. 4 out of 10 children end up being too thin or short. We are very fortunate to be working with a nonprofit called Arman that tries to address these issues. Arman is working with 26 million beneficiaries of mothers in India. It's active in 19 states in India. Very, very inspired by the founder of Arman, Dr. Aparna Hegde, who says that pregnancy is not a disease, childhood is not an ailment, and dying due to a natural life event is not acceptable. We were very inspired by Dr. Hegde, and I met with her in summer of 2019, and we agreed that we should collaborate and do something with AI, but what can we do? We arrived at a solution that we should focus on this mMitra mobile health program adherence. mMitra is one of the programs that Arman runs. And it bases itself on the fact that there's a lot of penetration of cell phones. Cell phones are used widely by people in India, and therefore our mMitra program uses that to send weekly 2-minute automated health messages to mothers who register in the program. So for newer mothers or expecting mothers, from the time they register to the time the baby is 1 year old, there are 140 messages that go to these mothers. These are small 2-minute messages, something like, you are 3 months into your pregnancy, you should use this health supplement, or your baby is 3 weeks old, get the baby vaccinated. Arman has shown with randomized control trials that mothers who enroll in their program, this mMitra program, and listen to all of the messages, benefit significantly for their own health and the health of their baby. In fact, 2 million mothers have enrolled so far in this mMitra program. So where do we come in? Unfortunately, 30 to 40% of these mothers enroll and then become low listeners or drop out of the program. To understand why, Arman took us around to the hospitals where they register these mothers, to localities where these mothers live. I have grown up in Mumbai, and I am familiar with some of these neighborhoods in Mumbai. These are families that live significantly below the international poverty line. Going into their homes, though, allowed me to understand the pressures that they are under, and as a result of which they may become low listeners. And we, of course, came away with significant admiration for the work these nonprofits do in these neighborhoods. Question is, what can we do to prevent these dropouts? Arman has the service call center from where they can give service calls to persuade the beneficiaries to stay adherent, to not drop out of the program. The question is, this is a very small number of service call employees. So these are people who are giving out service calls. They cannot call all of the mothers. And so how do you optimize this limited intervention resource? So if you think about 100,000 beneficiaries being registered at a time in mMitra, each of these 100,000 every week gets a health message on their cell phone. To prevent dropout, we can call only 1,000 of these per week. Which 1,000 should we call so as to maximize the total number of health messages that are listened to? To understand this, consider now this health worker, service call worker, who has 5 mothers under her care. Just for illustration, 4 of them are shown in red. They haven't listened to an automated health message. 1 of them is shown in green. She has listened to a health message last week. The health worker has to decide who to give service calls to, and in this case, only 2 service calls can be given. So she chooses the first 2. This turns out to be a good choice because these 2 red turn to green. There's another red that turns to green. So now the health worker has to decide who to call next week to encourage everybody to continue to listening to health messages. In this case, she picks the 2 who are red, but this turns out to be a bad choice because these 2 who are red don't turn to green. And in fact, those who are green also turn to red. What this is showing you is that a service call may not change beneficiary state. Beneficiaries may change state on their own, and yet we have to prioritize 1,000 beneficiaries per week. So how do we do that? We appeal to restless bandits approach to select K out of N arms per week. So in a restless bandit, each arm is a Markov decision problem. Each mother, a beneficiary, via this Markov decision problem, the mother might be in a bad state where she has not listened to a voice message, or a good state, she has listened to a voice message. We have this action of either giving a service call to the mother or not intervening, no service call. And now we have this transition matrix which models the behavior of the mother. So for example, when there is no service call, the probability of going from a bad state to good state is 0.2. But when there is a service call, the probability of going from a bad state to a good state increases to 0.8. So in reality, of course, this is just one mother, modeling of one mother. We have 100,000 of these mothers, so 100,000 of these Markov decision problems, and we have to choose 1,000. That's 100,000, choose 1,000 is a massive problem. To solve this, we instead compute what's called a Whittle index. Informally, it's computing the benefit of intervention on each arm, the benefit of giving a service call to each arm. This allows us to rank all of the 100,000 mothers or arms and then pick the top 1,000, which have a higher benefit of intervention. Formally, a Whittle index is the subsidy we would give to a passive action in a state. So there's the Q value of the passive and active action become equal. It's not important to understand the formal definition for the purposes of this talk. There is no out-of-the-box algorithm to compute this Whittle index. We defined one, fortunately, in 2016 that was useful for our purposes, and that's the algorithm that we are going to use for this work. Now, one issue here is that computing the Whittle index requires that the model parameters, the transition probabilities, be known, but we are not given these ahead of time. When a new mother arrives, we don't know her transition probabilities of going to from a bad state to good state, etc. What we do have are features of past mothers who have enrolled: age, income, education level, and engagement sequence. The mother was in a bad state, she got a service call, she remained in a bad state, service call, transition to a good state. So given this whole data that we have, features and engagement sequences of past mothers, we can now use clustering. And using this clustering, we can learn a mapping from the features, age, income, etc. of a particular mother to a particular cluster she belongs to. So when a new mother walks in, we can take her features, age, income, education, to map her to a cluster, existing cluster. From the cluster center, we can infer the transition probabilities. This is what we are doing to predict the mother's transition probabilities. Having done these predictions of transition probabilities, we can now compute a Whittle index. And then having the Whittle index of all of the mothers, now we can choose the top 1,000. So that's how we can figure out which top 1,000 mothers to call each week. Now it was time to run a field study, which we did with 23,000 beneficiaries. As far as we know, first large-scale application of restless bandits for public health. We divided these 23,000 into three groups, 7,667 beneficiaries per group. First group was the restless bandit group. The second was round robin. The third is current standard of care. In each group, we pulled the 225 arms. That means we called 225 mothers. In the restless bandit group, the 225 were the ones with the higher Whittle index. In the round robin group, we called the first 225, then the next 225, calling one by one these groups in a sequence. Current standard of care, no calls are going out. Now we want to know how many more health messages are listened to over the current standard of care group where no messages were going out, in the restless bandit group and the round robin group due to our service calls. So here's the result. On the x-axis are different weeks, and on the y-axis, how many more health messages are listened to in the round robin group and the restless bandit group over the current standard of care group. And what we see, the blue, the restless bandit group, 600 more messages are listened to in the restless bandit group compared to the current standard of care, with the round robin group shown in orange. Very few additional messages are listened to. In terms of statistical significance, restless bandit RMAP versus current standard of care, yes, statistically significant. Round robin versus current standard of care, not statistically significant. So what can we infer? First, it's important to optimize service calls. If we just call mothers in a round robin fashion, there's no improvement over current standard of care. And second, the RMAP improvement, the restless bandit improvement, is practically significant as well, because it cuts by 30% the drop-off rate over the current standard of care. So this result is very encouraging. And in fact, we have now deployed this restless bandit model in a system called Saheli with Arman. It's actually in use every week. There's choose service calls based on recommendations made by Saheli. 100,000 beneficiaries have so far been assisted by Saheli, and we are continuing to assist more. Dr. Aparna Hegde, having seen these results, points out that we are able to reach out to more and more women each week and get them back into the fold and save lives because of AI. You can see this in her video, which is on YouTube, AI for Social Good in partnership with Arman. What's also in that video is interview with one of the beneficiaries who benefited from this AI-based service call. I'm going to play a small clip of an interview with this beneficiary.
मी तो फोन नव्हते ऐकत पहिला, त्याच्यानंतर मला त्या ताईंचा कॉल आला, त्या घरी आल्या, मला समजवलं हा कॉल घ्यायला पाहिजे, तुझ्या पोरांसाठी चांगलं आहे ना. मग तेव्हा मी कॉल घ्यायला लागले आणि ते कॉल ऐकून खूप बरं वाटतं की कोणीतरी घरचंच मला कोणीतरी समजावायला येतंय. मग जसं ते कॉल ऐकते मी तसंच मी माझ्या पोरीचं संगोपन करते.
So this is indeed very satisfying because this mother is speaking in Marathi and this is all in Mumbai. So this is showing you some of the benefits of our Saheli deployment, but there are, of course, lots of interesting issues for AI research as well. So first of them is this decision-focused learning. This work is taking place in the context of a whole data to deployment pipeline. We start with the data, then there is this machine learning to map features, age, income, etc., to the behaviors, transition probabilities, and then we optimize, choose the top K beneficiaries, and then we deploy the software. So we are maximizing learning accuracy, and then we are maximizing decision quality, two separate stages. Maximizing learning accuracy, though, doesn't translate into maximizing decision quality. Here's an actual deployment result here on the two data sets, orange and blue in Arman. Orange has a higher predictive accuracy. We are able to more accurately predict mothers' behaviors. However, in terms of the deployment result, when we actually compute Whittle indices and call these mothers based on the orange data set and the bluer data set, which is lower actual predictive accuracy, it turns out that orange actually leads to less messages being heard by the mothers, and blue actually leads to more messages being heard by the mothers. So even though predictive accuracy wise blue is lower, from a deployment perspective, from computing Whittle index and calling mothers, blue is better. How does this happen? So let's look at this example here of features on the x-axis, transition probabilities on the y-axis. These blue dots are all the low-risk mothers, meaning less risk of dropping out. Red are all the high-risk mothers, higher risk of dropping out. And now if we do this two-stage, first maximize learning accuracy and then maximize decision quality, then we see that to the left of that orange bar is the blue dots, then the green regressor line is learned. What we see here is that it is able to achieve high learning accuracy, make predictions, better predictions on average, but it misses on the high risk mothers, and so it leads to lower decision quality. Decision focused learning is the idea of modifying the loss function to directly maximize decision quality. What it learns here is this green regressor line, which is shown at the bottom, which manages to more accurately predict the red dots. Overall learning accuracy is low, but higher decision quality. We have run an experiment with decision-focused learning with 9,000 mothers, and in this case, 3,000 were in decision-focused learning, 3,000 with two-stage learning, and 3,000 current standard of care. In terms of predictive accuracy, two-stage model leads to higher predictive accuracy, decision-focused learning leads to lower predictive accuracy. But in terms of actual deployment performance, when we compute Whittle indices and call mothers based on the actual Whittle indices that are computed, this is an actual result from the deployed system. We see that decision-focused learning leads to far more messages being listened to, shown in blue here, over a span of 10 weeks. 10 weeks are shown on the x-axis. The y-axis shows cumulatively how many more messages are being listened to. And we see 560 more messages are listened to with decision-focused learning, but much lower with the two-stage model. So decision-focused learning is what we have now deployed with Arman. The point here is that there are newer research opportunities that have come about by our work with Arman in the social impact space. There are many other challenges. For example, consider that we may not be able to, with limited data, make accurate predictions of transition probabilities. So we may say the transition probabilities lie within some interval, for example, 0.4 to 0.7 or 0.2 to 0.4. And this leads now to a newer challenge of how do you do robust restless bandit. So essentially, we solve this problem by minimizing maximum regret, where we're trying to play a zero-sum game against nature. So this is one interesting challenge. Another is showing you that there are different applications of restless bandits. For example, tuberculosis prevention. Tuberculosis is also a terrible disease, is a terrible disease in India, for example, and across the globe. In India, 500,000 people die every year due to tuberculosis. What TB requires is that patients take pills for 6 months, but that's very difficult. So patients drop out. Again, service call centers have to have health workers calling these patients to remind them to take their pills. So now again, every day the health worker is trying to decide who to call. She may call the first 3 patients. Now she may call next day. She has to decide who to call next week. This is also a problem similar to the maternal and childcare problem I mentioned of health workers deciding who to call every week from a call center. And so again, this is can be solved with restless bandits. There's a issue of partial observability that needs to be addressed. Another interesting challenge that comes up in this space. I'll end by saying that there are many interesting challenges in research. Our own research now is trying to scale things up. So for example, in Arman, instead of 100,000 beneficiaries, we're going to go to 1 million beneficiaries, which will happen in 2023. We're talking to the government of India about that Kilkari program, which is 10 times larger than Arman's Mitra program. And so we'll be working, hopefully, with this Kilkari program to assist the government again in trying to reduce dropouts from their program of providing health information to mothers. We're also working with a nonprofit called Kushi Baby to reduce malnutrition among babies. And our ICHKAI 22 paper discusses our work with a nonprofit called Help Mom in Nigeria. So this is just to show you that we are very excited about this work in AI for social impact. We are hopeful that the work we are doing will be of assistance to these frontline health workers who are trying to save lives. So thank you very much for listening to me, and I look forward to your questions. Thank you.
Okay, thank you so much, Milind, for such an inspiring talk. The solution that you described are very innovative and provides a lot of insights and it provokes a lot of questions for us. So let us dive into the questions that we have, and you can answer them, and we'll have our CTO Hiroaki comment, and then we can start the dialogue. Okay. So the first question is, so what were the key challenges you faced in working with Arman? Some of the technological challenges, but also infrastructure-wise, and maybe some kind of relationship building with Arman. And how did you overcome those challenges?
It's such an honor to be here, invited here. I'm very grateful in the company of Dr. Kitano, yourself. Thank you for inviting me and sharing our work with you. As you anticipated, the challenges we face go right from the beginning of the building of the relationship in AI for social impact, all the way towards deployment of the software. So it's the entire data to deployment pipeline whereby there are interesting challenges to be overcome. The work started with our first meeting with the founder of Arman, Dr. Aparna Hegde, in a Starbucks in Mumbai in 2019. And at that time, all we understood is that there is this nonprofit that is doing really inspiring work, and we want to assist them. But exactly what do we do, and how can AI help? This required a number of follow-on meetings to try and understand, among all of the different possible potential problems that Arman is working on, that Arman is facing, where could AI play a role? And after a number of discussions, we arrived at the problem statement that I discussed in my talk. But then the questions are, I will get to these questions in detail a little later on, but there are questions. Is this a problem where there is data? Is this a big enough problem that is going to make an impact? Is this a problem where once we build a solution, Arman would be able to pilot it, experiment with it, deploy it, scale it up? All of these issues have to be addressed. And in the meanwhile, we also have to understand if we can actually solve the problem with AI given the amount of data that we have available. So from the time of building up the relationship, from the immersion in the domain to deriving a predictive solution, AI solution, then making recommendations to all the way to deployment, there are interesting challenges. And the main way we feel that we have to overcome these challenges is to do this work in deep partnership with the nonprofit. It cannot be the fact that we develop the solution as AI researchers independently and then just provide an answer to Arman, but entirely throughout the process, again and again, go back to them, iterate with them. And we initially made some wrong choices and came up with a wrong solution. Now I can discuss that more, but realized that this was a wrong solution, then came up with a better solution. So I would say the main way of overcoming this hurdle is partnership, partnership, partnership. With those are the three main points of trying to overcome the challenges we face.
Thank you very much for sharing your experience. I think this is really inspiring that you have actually discussed with the founder of this organization, beginning from the identification of the problem, how to solve it, rather than saying, hey, we have technology, can I apply for that? Usually that kind of approach actually may not work, and probably like a significant mismatch between the problem and the technology that people might have. Particularly, I was really intrigued with the approach that you have taken, try to identify the issue to be the dropout rate for the call, and then apply the technology which you attributed as the bandit problem, and do the call pattern optimization, which actually improve the how many people keep listening to the call, and then how that actually impacts the overall wellness of the people. And that's actually really impressive, and really the solution and the approach and the theoretical basis that really match with the reality, rather than saying, let's get a big data and get the deep learning, and hey, we're gonna solve the problem, which sometimes it works, but not necessarily applicable for the problem that we are facing. And so I think this is really the beautiful example for the brilliant technology theoretical solution made into reality and impact society. Now, I really like to congratulate you on this accomplishment, but then I would like to actually have your insight how you get there. When of course, you had a series of discussions, the very serious discussion with this organization among identifying the real problem, but I got the proper solution. But not many people can do that. And then it would be nice to have your experience and the thought share with us. The mindset and then how you get there, how you actually come up with the idea, okay, this is the bandit problem, and then we're going to have a call pattern optimization. I think this is really the brilliant move.
I'm extremely grateful for your very, very kind remarks. Very honored, Hiroaki, for those words. I should point out that this is not a solution that we arrived at the very beginning. After initial discussions, we did identify the dropout rate problem as a potential problem to focus on. An initial solution was indeed to say, can we just make predictions on who are at high risk of drop off? And so we made those predictions, and then it turned out that we can point out to 50% of the people are at high risk of drop off. That means in a group of 100,000, we would say 50,000 people are going to drop off, have a risk of drop off. That's useless to Arman. Well, it's somewhat useful, but really doesn't prioritize the people, 1,000 people, and also doesn't take into account the fact that the states of these mothers change over time. So that the initial solution we offered was indeed a predictive solution that was a wrong step. But after creating that solution and showing it to Arman and realizing that that doesn't work, then we took a step back and said, okay, we have to refine the solution, because we initially thought that we could make predictions that would limit a very small number of people that are at a high risk of drop off, but only after working with the data, realize that it's a much larger number. But what you said, Hiroaki, is really crucial. This is use-inspired research. This is not something where we as technologists can go with a hammer and say everything we look at is a nail, but rather to start from the problem and then understand what is the right AI solution that can work on the problem. And here, it was only after this initial false steps and going back that we realized that this is a bandit problem that can be solved using these restless bandits. In general, in my experience with many of these problems, it is indeed the case that sometimes we arrive at some solution. Mathematically, it may be a very brilliant solution, but it doesn't quite fit the problem at hand. And so we have to be super careful in making sure that we go along with our partners and make sure they are satisfied with our solution.
Thank you very much. So you mentioned use-inspired research, starting from the problem. And you also mentioned when you think about what problems to work on, you mentioned availability of data, the impact of solving that problem would have on society. So my next question is, how do you actually decide or choose the social problems that you will work on? What are some of the factors that influence your decision?
So there are many aspects to this answer, and it's such an important question of figuring out which problem to focus on. Having grown up in Mumbai, in India, I am inspired by problems that had come up when I was growing up. So these are challenges related to marginalized communities that I saw there. And public health is clearly a big challenge that has motivated me. And here, as we look at these problems of public health, as an AI researcher, we have to ask, is the problem big enough that it is going to have some impact, especially the part that can be solved with AI? There's actually a list of 7 questions that comes out of an AI institute called Wadhwani AI, which is in Mumbai. And I'm repeating some of the questions. I wanted to give them credit for enumerating those questions, but these are essentially questions that I myself ask when I am trying to work with a partner. Is this a big enough problem that it will have an impact? Is there an AI solution to that problem? Because sometimes I'll go try to solve a problem, and the partners on the other side would say that we just need better equipment. We don't need AI. We just need better hardware, for example. In this case of Arman, that was not the case. Of course, they did want an AI solution that would solve their problem. Is there data for the problem? Because if there's no data, can we have access to that data? When we produce a solution, is this something that will be piloted by the organization? Because they may not be able to actually even pilot the solution. Can we do a detailed experiment with the solution we have so that we can provide evidence that our AI-based solution works? Once we provide all that evidence, can the solution be deployed and scaled up? Can it be, is this an ethical solution? And of course, as AI researchers, we want to know in all of this, is there an interesting AI problem? Because otherwise it could be a very simple solution, which perhaps is more suited to a class project or some student trying to address it. So these are the types of questions we ask. And sometimes we find that an organization will come, start to work with us. They're very excited. We are very excited. And then it turns out they don't own the data. The data belongs to somebody else and they cannot give us the data, for example. So there are a lot of challenges to overcome in each of the questions that I've asked. And we want to ask those questions up front. And then based on all of that, decide that this is the right organization and problem to work on.
Thank you very much, Milind. I think like a very insightful, and I think it could be really kind of a more universal criteria that you're mentioning. And of course, like when we talk about like a sustainability issues or social good, there are many problems, many important problems we want to solve, but at the same time, not every problem AI can contribute. I mean, sometimes you just want to have, as you said, the hardware. We just need the money. You just have to the social infrastructure. Well, not really the AI, but I think I believe like AI can contribute a lot. But of course, like there are problems we can actually use AI. We cannot use AI. But I think like but this choice is very interesting, and I also like very fortunate that you happen to meet the Amman founder. I think there's certainly a part of the factor of the luck, but at the same time, I think you have to be prepared to just take advantage of luck and make something happen.
Yes, I should point out there have been other organizations, other problems that I have worked on, which are equally crucial and important. One example is there was an organization that was working with lost and found children. I mean, this is such an emotional issue, and I had really wanted to work with them to see what AI can do, but there was no data. They didn't have any data for us to work on, and so. As you point out, there are, Hiroaki, I really appreciate the thought you put forth that indeed there are problems where AI, is not the right solution, but there are problems where AI is the solution. But even if AI is the right solution, then there are further hurdles like getting the right kind of data and the organization being able to supply that data to us. And then all the other problems that I've mentioned, such as being able to deploy the solution and so on.
Thank you, Milind, for a very insightful set of questions to ask before we kind of take on these social problems. Now I'd like to ask you, based on your experience, could you touch on what are some general principles in applying AI to such social problems? And on the other hand, what are some of the pitfalls? You mentioned some already, but what are some of the pitfalls that we should kind of avoid?
Some of the pitfalls that we should avoid include problems related to ethical deployment, responsible deployment, challenges that may come up because there may be crucial side effects that we may not know. In our work with nonprofits, we always, of course, want to make sure that these are nonprofits that are working with ethically with the local communities and so forth. Certainly, Arman was an organization that has done impressive work, very deeply rooted in the local communities. But sometimes there are challenges that we observe. Some years ago, for example, when we were working with problems related to wildlife conservation, this was some years ago. If you're using drones, for example, for wildlife conservation, are there problems in the use of drones that may come up? Are the drones being used for some other purposes than the ones that we are working with the organization for? So these are some of the questions that may come up about ethical deployment, responsible deployment that we may want to be very careful with. I think in terms of other pitfalls that may come up there can be a sense that we as AI researchers want to show off our brilliant AI solutions and we want to publish papers. But that solution may not actually bring as much benefit to the organization. There's a cost to this AI solution to be deployed, and there's a benefit. And this cost and benefit needs to be properly balanced. And perhaps our egos shouldn't come in the way of trying to show off the AI solution, even at the cost of a loss to the organization which is deploying that AI solution. That may not only, there may be several problems that may arise, because if we say that a certain AI solution is working brilliantly, but it is not, it may mislead others into thinking that that solution works and lead other organizations on the wrong path. So these are some of the challenges that I can immediately think of in terms of addressing using AI solutions for social problems. And I'm sure there are others as well, but let's start there.
Yeah, thank you very much. It's a great point. We talk about like a responsible AI, but at the same time, like your point of like ethical deployment. I think this adds to the new dimension because not just like AI's functionality by itself, but like how this organization use the AI to for the deployment. But at the same time, like all the cost issues. Of course, like the researchers tend to wish to claim that our technology is useful. But the same, is it really useful? But are you actually putting, exerting extra cost for the organization? For the organizations, might say, well, this is great, but in the long run, it doesn't work, and then they will discard it, and then, if the misinformation being propagated, people repeat the same mistake, and, that is actually, in the long run, it's not sustainable. But, so I think like this is really the important issues. So it that mean that you really have to work with the organization and then you have the good insight of the issues so that you can actually identify what are the potential issues in the deployment in a specific problem, as well as the nature of the organization, whether the organization is trustworthy or not. So like that whole thing have to come into play. And that's why I think you have to spend a lot of time discussing with the organization, identify the problem, build up a trust, get to the mutual understanding, and where we're gonna go and solve the problem together, rather than transferring a technology. Am I correct in understanding that is a long journey, but that's the only way probably?
I appreciate that analysis. Yes, it is indeed a long journey, and it implies there are a few things that we as AI researchers need to do to support this long journey. One of them is currently the way many AI conferences and publication venues, which is the currency, right, for AI research, is being able to publish. They are focused very much on methodological improvements in showing the brilliance of the AI solution, as opposed to understanding that this long journey also brings about its own challenges. And they're not necessarily all methodological challenges, they're not all algorithmic challenges, but they are evaluating cost and benefit of an AI solution. It's understanding experimentally whether AI solution worked or not. All of these are important scientific contributions in some way, but we need to value them. And unless we encourage AI researchers to be able to publish these works and share their findings, it is going to be difficult for others to understand that these are important challenges, and AI researchers will not engage in them. So it is our responsibility to provide opportunities, platforms for AI researchers to share this kind of work, to understand that this is actually important scientific contribution and encourage it so that this long journey can be undertaken. It also implies that currently there is a certain gap, because these are often applications that are built for nonprofits. These are works for marginalized communities, wildlife conservation organizations, nonprofits working in difficult circumstances. We certainly wouldn't want them to hire software engineers to maintain the software, the AI, after we as AI researchers are done with them. And so currently there's a bit of a gap on how these AI solutions will be maintained past the point when the AI researchers have done the research, shown that it works, deployed it, and they go home to a new problem. Who's going to maintain that software if the organization is not able to pay for it? This is going to be an important problem in this field that needs further thought and support from the AI community.
Yeah, again, Melinda, I think that's a great point. I mean, kickstarting project is great, get the deliver the result, but can it be sustainable? Can we maintain it? But it can't really, throw it and then stay there, like a muzzle. It's not going to be like that. Someone have to maintain, continuously improve it. Yeah. Do you have like a insight on the how that can be approached? Like, for example, like a corporate social responsibility or NGO or government sectors, but at the same time, this has to be done by the at least like a certain level of engineer who understand things, not just like can't really ask a random person to take care of.
Hiroaki, I look to you for advice on this matter. I mean, you were brilliant in starting the RoboCup initiative and bringing together the whole world in trying to build robots that play World Cup level soccer. And so we need an effort of that type, a RoboCup for AI for social impact, whereby organizations can come together and form partnerships that would support these long-term deployments. I certainly feel that we could imagine there are a lot of talented AI researchers, software engineers who want to loan their talent for these social causes, but they cannot do it full time. So maybe they have some time that they can loan. And there are organizations which need this talent. And maybe there's a matchmaking service that's available on a global scale or at least regional scale, whereby some of the software can be supported. Those are some thoughts I have, but really I feel that it needs a RoboCup, 2050, that kind of an effort, but in the AI for social impact space to make this happen. And it's an important problem. I should also mention that there are even within this space, right, of the software maintenance. We shouldn't. There are lots of research problems there as well. It's not simply a matter of maintaining that software because, as these AI systems learn, for example, newer and new, machine learning is continuously going on. They may learn newer things. There's lots of things we don't understand about how drift might happen and what kind of changes may happen in their behavior, and how do you deal with the fact that because of these changes the AI may start doing the wrong thing, and how do you overcome some of those limitations. So it's not as though we have completely solved the problem of long-term deployment and it's only a matter of maintaining. There are some interesting challenges still open there.
Yeah, I think your point is exactly right. I mean, RoboCup turned out to be like a research-oriented initiative, but also like expanding into the educations and the disaster rescue, but because a global phenomena, when it's actually going on its own. I think like a stable organization globally, I think we can actually learn the lesson from the RoboCup and apply to this specific problem. When Sony Group Corporation wish to be the part of that initiative once we get. So I think we can continue, this dialogue, and then hope we can, find the solutions and then, take it further together.
Absolutely, I would be delighted to participate in such a initiative.
Thank you very much. On that note, I'd like to ask Milind, do you have I'd like to hear your advice to aspiring researchers and engineers and students in AI who want to work on such social problems by applying their AI expertise. What kind of advice would you give them?
In order to engage in AI for social impact, first, you really have to be interested in social impact issues. And not everybody necessarily needs to, because some people are pretty much motivated by trying to improve the technology, and that's all wonderful. So if indeed this sort of social impact issue is important, then the next step really is to find the right kind of partners. And there are many avenues available to find these partnerships. I should point out here, for example, in Google, we've initiated this matchmaking of AI researchers to nonprofits, so they can apply. AI researchers can apply, so it's an annual program. To this program, nonprofits can apply, and then we do matchmaking where each AI researcher meets with 3 nonprofits, each nonprofit meets with 3 AI researchers, sort of a speed dating, and on the basis of match, they'll write a proposal and then we'll fund it. So that's one way in which AI researchers, junior AI researchers, may be able to find nonprofit partners. But there are others as well. at Harvard, for example, we have invited local area nonprofits at our Center for Research on Computation and for Society, and then use the local nonprofits and local researchers, meaning at Harvard, to do matchmaking to find interesting problems to work on. We've invited nonprofits also even in our classrooms sometimes to find. So there are many avenues to find the right partners. And then I would advise them to go to the field, to the place where the actual work is going on. This work cannot be done by sitting in the lab and thinking of solutions. There are many instances where going into the field will reveal fundamental constraints that we may get completely wrong if we just derive the solution in the lab. Immerse yourself in the domain, understand, and this will also build trust. The next piece of advice is really patience. Sometimes I'll have students who say, well, I had my first meeting with a nonprofit and they didn't even give me an AI problem to work on. And I have to advise them that it's not like they'll come to the meeting and then start saying sum over I, xi, that's the problem, that's the problem you're going to solve. Initially, they don't know what AI is capable of or what kinds of problems are even solvable. Or sometimes they may have an opinion that AI can solve everything, and they may come and say, well, AI can solve all of the education problem or something like that. And so you have to sort of have this dialogue to arrive at the right kind of solution, and it takes some time. Then after developing an initial solution, iterate with the nonprofit, and sometimes you may get it wrong. And I think we have to have the patience and the respect towards our partners to understand that, we may get it quite wrong as AI researchers, and they may have a fundamental point that, the solution needs to be changed in some different ways. Throughout, I think it's an issue of having patience, of deep partnership, of being immersed in the domain, and being really deeply motivated by causes of social impact as much as we are interested in writing our own papers and so forth, so that it is not purely driven by, we got to get this paper done, but very much by, okay, we want to really achieve this social impact. And along the way comes AI research, which is a side effect or a side product along the way. It's, in a sense, we are saying that AI research and social impact are both first-class citizens of this universe, and both need to go hand in hand. And it cannot be the case that AI research is the top priority and social impact is just secondary. These are some of the things that I may humbly offer as advice for junior researchers who are starting in this space.
Thank you very much. I think that's a great point. And, I think this applies not only AI, but the, broad range of technology, whether we apply this technology to, problem to be solved. One of the researcher at Sony, Ken Endo, who used to be at the robotics researcher, he was creating a biped robot. Now, he actually transformed himself to be the prosthetic device researcher. He got a degree in MIT Media Lab, and one of the projects he did, going to India in Jaipur, working with the Jaipur food, trying to create like a cheap prosthetic device, but like a little bit of technology in a 3D printer, so that it makes it much more easier for the people with the prosthetic device to be able to work. And then, but of course, like a cost has to be very low. Cost has to be like a $10 or something. But still much better flexibility than the conventional prosthetic device, which is available in a region at a time. So I saw one of his video. This young lady has lost a leg, and then usually she has been moving around with one leg, jumping around. Now we saw like a very emotional movie. The moment she actually have another leg, prosthetic device, and start walking in a biped. And that was actually one of the most emotional scene with the video, how technology can contribute. But at the same time, but Ken's case, he commuted to India, Jaipur, many times, but understand what the situation is, and then come up with a solution. Back in the MIT, and also like now he's a researcher at Sony CSL now. he's doing high end. He's doing the robotics prosthetic device, and he's doing the blade for the athlete for the winning the Paralympics, and he actually contributed the team who won the bronze medal at the Tokyo Paralympic. So, which is actually really the mindset issues. In addition to the technological issue, how you want to contribute to the society or people who are in need, and so that you can actually forget about like a high-end thing, but you have like some wisdom, you have some know-how, how you're gonna get some essence of the technology into the very, very affordable solution, which is actually appropriate in the region. So I think like what you have described has a deep implications. Every one of us should really remember when we try to apply the technology to the real world, particularly for the social good.
What you described is absolutely a beautiful example of how technology has impacted people in Jaipur. And thank you for all the work that your colleagues are doing towards that end. And one of the main points you made also is, I appreciate that very much, that at least when it comes to social impact towards more marginalized communities, that the solutions are often in AI terms, one of low data, low compute, and low resources. And we have to work with those constraints because this is not a situation where we are working with organizations that have tons of data. We have to have data, but it may not be plentiful. And often we have to find ways to work with those limitations and what kind of extra data can be collected on a selective basis. That becomes an important problem in itself. Low amounts of compute and also low amounts of resources, because we can't just say, hey, go out and deploy all the sensors everywhere and then we can solve the solution. Or why don't you give high-end smartphones to everybody, and then we can solve the problem. And so as you described in the foot that was built, low cost technology that makes a big impact. I think that's a beautiful example, and that's the type of thing whereby understanding these via this partnership, we can understand what are the constraints that we are operating under and build a solution that fits within the constraint. I often tell my PhD students that often the PhD is actually in the innovation that comes about because these constraints are so important and they constrain the kind of AI solution that you will build. And that's often where the PhD comes in, because normally you may not think of a solution, but now that there are these real world constraints, a completely new solution has to be developed. So it's a win-win also for the AI researcher.
Okay, thank you very much. Now I would like to pose my final question, this time to both Milind and to Hiroaki. To Milind, so you touched on the role private enterprise can play in advancing AI for social good. What are your thoughts on that? And also to Hiroaki, how do you think Sony can contribute to advancing AI for social good?
As I mentioned in the earlier remarks, I've been extremely impressed. I mean, what Hiroaki has done with RoboCup and really starting a worldwide movement for advancing robotics and AI, and that has spread into disaster response and education and other aspects. We need something very similar, the RoboCup of AI for social impact, a global movement. And I certainly feel that private enterprise will have a big role to play, just as Sony did with the RoboCup effort. And this is not only in terms of encouraging people to contribute to AI for social impact, but as we've discussed earlier, providing some type of a infrastructure so that once these solutions are developed, that they can be maintained, they can be supported via AI talent, via software engineering, other resources that are needed so that these solutions don't die off once the interesting research is done. We also need help in terms of promoting this research by encouraging venues. The RoboCup global competition is an important example whereby research in RoboCup was highlighted. Maybe there's not necessarily a competition, but a collaboration for AI research, whereby there's a global stage whereby people can come in and feel that their work is appreciated. That may also encourage further AI research. So I can see from building partnerships, helping build partnerships with nonprofits, to helping encourage research, to helping sustain the research. In all of these avenues, private enterprise can really play an important role. And thank you for having invited me. Thank you for all of these wonderful questions. Really appreciate it.
Thank you very much, Milind, for your answer, and thank you very much, Alan, for the question. I think this is really the important questions. To be a good corporate citizen, how Sony Group can contribute to the AI for social good. Well, not just AI for social good, like how we can actually help people in needs and social good in general, using technology, not necessarily AI, but much broadly. Because like a solution, sometimes AI can be useful, sometimes other technology could be useful as well. I think like, bottom line is we cannot do it this alone. I mean, we need a partnership with the corporate sectors, with the non-government organizations, people in needs, like people in the village and people in the city, and then also government as well. And I think we need to extend to create a network with a partnership. Like I think some of the problem, Google and Sony can work together, solve specific problem involving the university, like Harvard and other places as well. And I think it's really the important issue is identify the problem, identify the people in need, how we're gonna reach a solution which is sustainable, and then from there we can take it from the next stage as well. So I think this is really important. So one of the lessons we learned at RoboCup is that if you got the right vision and then genuine management, and then how you get the mechanism of the organization which actually grow by itself, I think people come. I think like passions and then the vision to actually make things into the reality is something people drive. But of course, like a RoboCup, Milind, thank you very much for mentioning RoboCup many times. I think cannot actually grow and succeed like we have today without help of the many companies and then very passionate researchers, also the multiple government sectors, to support the RoboCup activities. And I think like we learned a lesson a lot. There are successful parts of RoboCup. There are things we have to improve. And at the same time, the good news is like AI and robotics community, there are many RoboCuppers. We are the RoboCuppers. Also, like we have a Peter Stone, current president of the RoboCup, but also like in a Google and Sony, in other high-tech company. There are many RoboCuppers. And so they actually understand by experience and how things can be created. I think that's really important part. I think the partnership is what matters, and share the visions and share the solution. I think it's very important part. And the second part is I think like those real world problems sometimes looks messy, but you can come up with like extremely interesting scientific outcome which can be applied broadly. I was stunned looking at the solution that Milind offered, this bandit problem, specific call type, optimization. This is a problem for the specific issues. Starting from there, try to minimize the dropout ratio rather than a random call. We have like a specific call pattern. He already applied to the other issues, like tuberculosis compliance as well. This compliance, is a big issue. We have a drug, or we have a specific measure that people can improve their health state or other problem, but all the compliance, they actually drop out. So if we can actually apply this technology or approach to the broader domain, which the compliance and dropout is the issue, that can be a problem. That we can actually, a lot of people can benefit. It's not really for the, all the social issues in developing countries. Even industrial countries, we have an issue of, obesity and then other issues, which patients needs to have like a consistent compliance on the exercise or drug intake, and the dropout ratio is rather high. So like it can be applied to industrial countries as well. I think like the solution that the Milind came out is this is something like a lot of people want it. Now he actually showed there's a solid mathematics, solid theory, and the practical applications, and he delivered. And then the outcome is very clear. I think it's really such a powerful solution. I was really stunned at the looking at these solutions, and I think like for this kind of problem, sometimes people think, oh, but this is so messy, it won't have like anything nice in theory that you can publish in a nice journal. It's not necessarily the case. I mean, this is a very good example that from the real world problem, which appear to be messy, but if you think through and you have like a truth in there, you can come up with a nice scientific theory which a broad applicability, had a big impact. So that brings us yet another long journey, I guess. But still, I think that's really the high impact outcome. So I think like all the partnership and then capability for us to really understand, dig deep in the reality and the theoretical in both. I think that would be the holy grail of the research and then how that can be applied to the real world problem.
Agreed. Wonderful remarks. I guess I'm happy to end it here if you want, but happy to continue the conversation whichever way you want.
Okay, we'll end it here.
Yeah. Milind, thank you very much for joining us. That's been a wonderful conversation. We learned a lot, and we actually witnessed the depths and the compassions. I think this is just a great endeavor that you have accomplished in this program. I think I'm sure you have many of such programs now and probably in the future as well. And then I hope we can work together in some sense, and then also together we can contribute to make world a better place.
I'm extremely grateful for your kind remarks, and thank you for inviting me. And I would love to continue this conversation. And you mentioned you are sometimes in Bangalore. Hopefully, our times in Bangalore will overlap, and we can meet in person there.
Thank you very much. Let's do that.
So this brings us to the end of today's discussion on AI for social impact. Thank you, Professor Milind Tambe and Dr. Hiroaki Kitano for such an inspiring and thought-provoking discussion, as well as practical advice based on your deep and extensive experience in solving social problems in the field. We really look forward to working with you in the future. Once again, thank you so much.
Thank you. Thank you very much, Milind.
I'm very grateful for the invitation. Thank you.